Hello.
Hi, how are you?
Good, how are you?
Doing well, thank you.
I had to move to a new location, not new, but not where I usually work in my house. So I was like, let me get on a little early, make sure everything sounds. My computer this week has been doing this thing where it's like time delay, where I speak and then the people I'm talking to are like, your mouth is not matching. So I was like, I need to fix this before Wednesday. Just restarted it a couple times. Seems like it's fixed. So.
Well, yeah, it's fixed. It's
I was like, that
fixed.
would be kind of weird for a webinar. Maybe be a little irksome to people. Nice to see you.
Nice to see you too. Are any of the folks that are in the participants, are you able to see that? Are any of those yours?
I just see someone named
Folks.
Ariel Lopez, but that
Oh,
I don't know who
okay. You
that is.
can't see the attendee. Okay.
No.
Ariel, will you make her Artie a
Oh,
co-host, please?
I see Carol Marin.
Yeah,
So,
that's
Hi, Joanne.
Hi, Kelly. How are you?
I'm good. How are you?
Doing well, thank you.
How many people are you expecting today?
I honestly I don't know. Usually when we make them mandatory, we see a bigger crowd, but I'm thinking between 1 and 150 maybe today.
Well, that's pretty good.
So I'm hoping for
What's the maximum you usually have when you have a mandatory training?
um between 350 and 400.
Oh, wow, that's a lot of people.
Yeah. Do you all have an agenda that you're gonna go over? Is there like an order that you're going to present and then possibly take questions at the end?
Yeah, we have PowerPoint slides. I'm going to speak first, and then Lanisha and Arthi will speak, and we have discussion questions like in the middle to encourage them to interact and ask questions, and at the end too, if we have time.
Okay, perfect.
Yeah, we'll do like an OVP overview. I'll share a little bit of violence data and talk about, all of our initiatives very briefly, and then Arthi and Lanisha are going to go in more detail on our trauma prevention initiative where I know this is like all of the grantees are attending this one, I believe. So, we definitely want to open it up to them to find ways that they'd like to connect to us so we can see if there's interest in other initiatives that we have or even more data. We can do a follow-up presentation in the future.
Kelly, I'm sorry to interrupt. I accidentally made you the host instead of the co-host. Are you able to make me the host and then I'll make you a co-host just so I can make sure I'm letting in the right people?
Oh, yeah. Let me.
Thank
Okay.
you.
Okay, did it work?
Yes, it did. Thank you. And I'm going to make you a co-host now. There we
Okay.
go. And then you should be able to share your screen and anything, but if you run into any tech issues, just let me know.
Okay, we'll wait till you give us the go ahead to pull it up. I don't know if you're planning an introduction or if we should just dive in and start.
I think Joanne's going to be doing an introduction and then she'll send it over to you guys.
Okay, great.
Hi, Tonio, I see you in the chat. Yes, you are fully in for the webinars. Attendees don't need to worry about having their cameras on. So you are fully in, you'll hear the whole presentation, but we cannot see you.
Oh, our colleague Lanisha won't be joining us today, unfortunately, so it'll just be Artsy and I.
Okay, thank you.
Hi, everyone. For all of our attendees, if you could drop your name and what organization you're representing in the chat box, that would be great. Thank you. everyone, as you're joining, please drop your name and the organization that you're representing in the chat, please. Thanks everyone for joining. We're just going to give everyone a few more minutes to join. As you're joining, if you've not done so already, please drop your name and the organization that you're with in the chat. Thank you.
Afternoon, everyone. We're gonna give everybody a few more minutes to come on in and join the webinar today. If you haven't already, please put your name and the name of your organization in the chat. Thank you. All right, it is 2:03. We're gonna get started here. I'd like to start out by thanking those of you that are here. Thank you for joining us today. If you haven't already, please put your name and the name of your organization in the chat. Today we have two presenters from LA County Office of Violence Prevention. We are very excited to have them here and meet with all of our grantees and hopefully make some connections with our grantees. So the Amity team is really looking forward to having you here and looking forward to this presentation and making those connections. So I will pass it over to Kelly and Arti. Thank you so much.
Thank you so much, Joanne. We're really excited to be here. I know we've been meeting with the JCOD team in the county to see how we can coordinate better with all of their work, including the CFCI work. So this is really an opportunity to share a bit about what we do in the Office of Violence Prevention. We're going to share a lot, and I think this is really a first opportunity for us to connect with you, and we really want to invite you to connect with us if there's more info or resources we can provide or ideas you have to connect. So first, before we get into the presentation, we try to integrate trauma-informed practices in everything that we do, and we're always learning on how to do this better. So a content warning, and it's an invitation for self-care for all of you, because in this meeting we will discuss strategies and data that address violence. This is a difficult topic for all of us, even those of you who are immersed in violence prevention intervention work, and it has an impact on us in a professional and personal level. So we really encourage everyone to take care of themselves first as a general practice and seek support and practice self-care. And this includes if you need to step back from the meeting, we invite you to do that as well if there's a content that is troubling. We also begin with a land acknowledgement. The County of Los Angeles recognizes that we occupy land originally and still inhabited and cared for by the Tongva, Tataviam, Serrano, Keats, and Chumash peoples. We honor and pay respect to their elders and descendants, past, present, and emerging, as they continue their stewardship of these lands and waters. We acknowledge that settler colonization resulted in land seizure, disease, subjugation, slavery, relocation, broken promises, genocide, and multi-generational trauma. This acknowledgement demonstrates our responsibility and commitment to truth, healing, and reconciliation, and to elevating the stories, culture, and community of the original inhabitants of Los Angeles County. We are grateful to have the opportunity to live and work on these ancestral lands. We are dedicated to growing and sustaining relationships with Native peoples and local tribal governments. There is a phone number and a link at the bottom of the slide where you can learn more about the Indigenous lands on which you live or work or are visiting. So here's a snapshot of our agenda. I'm going to provide an overview of what we do, a little bit of data, some of our initiatives. We are a growing office. We're a smaller office in the county, but our work is growing. And there's a lot of opportunities to connect with our strategies and initiatives. We definitely want to be a resource for all of you. The presentation will dive a little bit deeper into our trauma prevention initiative, which is our community-driven public safety strategy that invests in community violence intervention work and prevention and capacity building strategies. We'll talk a little bit about ways we're currently collaborating with cities and other county departments, and some opportunities for potential collaboration with the CFCI grantees. And throughout, we'll have a couple of breaks for questions and discussion, because we would love to hear from you as well, and invite you throughout, to add your questions, comments, or information in the chat. So our office is in the Department of Public Health in Los Angeles County, and we take a public health approach that looks at the social determinants of health or root causes. And this is a diagram we love to use because it really encapsulates how we look at social determinants using the tree metaphor. If you see on the right, there's a beautiful thriving tree, and in the roots you can see things like social support, quality schools, access to recreation, a clean environment, income, housing, jobs. And you see in the top, although there are incidents of violence, depression, stress, chronic disease, they're lower, And on the left, you see a tree that is really struggling, where these negative outcomes are much larger. And in the roots, we have poverty, segregation, income inequality, institutional racism, unemployment, environmental toxins, other things. So what really this tells us to do is that we really need to work together to look at those conditions and communities that are causing disproportionate harm in our communities, and how we can improve those conditions. And we see this work as public safety. We know many people just think of law enforcement when they think of public safety, but this quote from civil rights leader Angela Davis really encapsulates our thoughts about this. Security is not possible as long as the physical, mental, and spiritual health of our communities is ignored. Safety and security requires education, housing, jobs, art, music, and recreation. I think, what we know about the CFCI funded work is it's very broad, and you're contributing to public safety and doing the work that you're doing to help your communities thrive. So our office was established by the Board of Supervisors in 2019 within the Department of Public. We were a small program before that. We've been around, I think, since the 90s as a small program. But this board motion gave us a larger charge to work with our county and community partners to build collaboration, strengthen capacity, and forge partnerships to prevent multiple forms of violence and promote healing across the county. We have a vision for a violence-free LA County, and we work with a county leadership committee that includes about 30 different county departments, and also a community partnership council that includes experts in different forms of violence and healing across the county, and survivors as well, to guide the implementation of our work. So a little bit about the role of county and public health departments in violence prevention. I think there's a number of ways that we are helpful for violence prevention and public safety. One is to facilitate a regional approach. We collaborate often with cities and unincorporated communities and different agencies to build shared protocols, to share resources, etc. We're also, as many county departments are, a fiscal intermediary to get funding to CBOs. That's definitely a priority for our office, to get as much funding to grassroots organizations on the ground as we can. Connecting and aligning county services and strategies. I think by definition, the social determinants work in violence prevention really requires us to work together. So we see ourselves as conveners to help make that happen. Supporting services in unincorporated communities. This is where, for example, our trauma prevention initiative work started. Our unincorporated communities often have less representation than cities and fewer resources, so they are a priority. Building a holistic, comprehensive approach to address root causes and engages community and survivors in the solutions, and facilitating collaboration and coordination among stakeholders. And these are really shown in this slide as well, and what a public health approach to violence prevention is. We're looking at building up protective factors, looking at the impact of violence on the population level, not just individuals, looking at peers, systems, communities as well, and how that impacts everything. And most importantly, engaging those who are most impacted, including survivors or perpetrators, in developing and implementing the solutions. I'll share a little bit of data on the impact of violence. We can always do a deeper dive if folks are more interested in data. But to show some key indicators, we look primarily at violent deaths and injuries in Los Angeles County. And this is a snapshot from 2023, which is unfortunately the most recent year available for all of these indicators. But you can see homicide and assault on the left, and suicide and self-harm on the right. And you can see for emergency department visits for assaults, there's a staggering amount in the county, over 33,000. For suicide and self-harm, that number is a bit lower. However, if you look at the deaths, the suicide deaths in LA County, 875, are higher than the homicide deaths in LA County at over 600. So we always use data to look at, where we need to prioritize our resources and design our different interventions. We also look at trends. So this looks at both homicide, assault, and suicide and self-harm trends since 2018. The suicide and self-harm is in the red, and homicide and assault is in the blue section. And if you start with the bottom, you can see that suicide deaths continue to be higher, over the past few years than homicides. I think that's flipped. If we looked at earlier data, it was higher numbers of homicides in the past. And the trends are relatively stable. And if you look at the hospitalization data, the dotted lines at the top, you'll see that assaults have declined, and so has self-harm and hospitalizations. With assault hospitalizations, we did see a slight uptick in 2023, and we're continuing to look at those trends. We know some of this is impacted by the COVID pandemic around 2020, 2021. We also look at the involvement of firearms in violent deaths for LA County residents. If you look at the graphs, you'll see that the firearm in blue count for a much larger proportion for homicide deaths than injuries, and that's because of the lethality of firearms. They're most likely to result in death and suicide. Only about a third of suicide deaths involve a firearm. We also look at gender distribution of violent deaths. For homicides and assaults, a much larger proportion are males. And for suicide deaths, a much larger proportion is males, but for self-harm, it's largely females for both hospitalization and ED visits. And this shows, differences in both how these issues impact different populations, and also how we need to adapt what we're doing in our prevention and our healing work. When looking at race and ethnicity, looking at homicide and suicide, with homicide in the blue and suicide in the red. For suicides, the most impacted population in LA County are Native Hawaiian Pacific Islander population at 17.2 for every 100,000 residents, followed by white community members. And then for homicides, staggeringly impacting Black community members at 26.5 per 100,000 population, followed by our Latin communities. And this really shows, if you look back at that social determinants of health slide, how we need to do a much better job of addressing the disparities and the systemic racism and discrimination that are resulting in these rates. We also looked at age, and you can see very different trends comparing the red, which is suicide, and the blue columns, which are homicide. Suicide deaths tend to impact older populations, whereas for homicides, you're seeing the highest rates among 25 to 34-year-olds, and those decrease as they get older. And we also looked at region in the county and found that for homicides, the most impacted service planning area was SPA 6, which is South LA, followed by SPA 1, which is the Antelope Valley region. And the Antelope Valley region also had the highest rates of suicide deaths in the county. And we also have data looking at the impact of intimate partner violence and sexual violence. This is data that is really hard to get accurate data for. This comes from our LA County Health Survey, which asked adults who have ever experienced physical or sexual violence by an intimate partner in their lifetime. And you can see the rates are much higher for females than males. And as people grow older, there's more of a likelihood that they will have a lifetime experience of that, of sexual violence by an intimate partner. So now we'll talk a bit about our key programs and initiatives in the office. This is the majority of our work right here is on this slide. That includes our original strategic plan and some newer initiatives. One is establishing regional violence prevention coalitions because LA County is so large. We want to make sure that we can connect with all the stakeholders and the great work going on the ground. And that, we've worked with them on developing action plans and their focus on gun violence prevention policies and activities. We also have an amazing research and epidemiology team that has a lot of data. So if anyone is interested in more data, we can help with a request. But we've created an accessible open data portal on our website. We're still building that out and adding more to it, and would love input on what that looks like. Expanding the trauma prevention initiative to additional communities, and this is something that Arti is going to talk a little bit about after my piece of the presentation. Implementing a crisis response pilot in South LA. I'll talk a little bit about that. Healing centered and trauma-informed system change. This is something we're hoping to integrate in all of our work in the office and work with county and community partners on. Shifting the narrative about violence and trauma, using communications tools and approaches. Promoting firearm safety, and investing in gender-based violence prevention. So I'll talk about each of these really briefly. So our crisis response initiatives include two primary programs. The first one is Care and Response Team, which is in South LA in the 2nd District, primarily in our trauma prevention initiative communities. And this is to provide healing support for a number of different traumatic incidents that are impacting community. So they respond in home and in community to individuals and families. They provide outreach to the community to promote healing and also link them to other services. So they respond to, as a supplement to our community violence intervention work, respond to homicides and shootings. They also respond to school incidents, hate crimes, domestic violence, and other traumatic incidents. We also have a family assistance program, and this is a program that started at the Department of Mental Health, and it transitioned to our office about a year ago. And we have a team of social workers who support families who've lost a loved one from a deputy fatal use of force or death in custody at the hands of the Sheriff's Department. So they provide grief counseling, navigate the systems, working with the medical examiner's office and the sheriff's department, and provide burial costs reimbursement. And these are, certainly programs that you can connect to if you have community members that need assistance. Trauma-informed systems change is definitely a priority for our office. We have one staff person who leads all of this work in our office and does a lot of training with community partners and county departments. If this is something that you're all interested in, we can schedule a more in-depth training. But this work includes training, communications tools, learning collaboratives, training staff. For example, she's worked with Parks and Recreation, the courts, and the DA's office to build their capacity for a trauma-informed approach, and policy development. And there's one of our web pages has more resources and handouts that might be helpful to you that talk about trauma-informed practice, self-care tools, support children and young people who've been impacted by trauma, how to recognize the signs, and many other materials. We can definitely drop these things in the chat as well. One of our first communication strategies around shifting the narrative around violence and trauma is the Violence, Hope, and Healing Storytelling Project. Our goal with our communications is to really rally people around the idea that violence is preventable. We all have a role to play, and we need to center community and survivors in doing this work and promoting healing. So we worked with the Department of Arts and Culture in the county. We had an artist in residence who collected more than 100 stories from survivors of violence across the county, talking about their healing journeys. That's culminated into a book and photographs that are available on our website. And we are wrapping up a second phase of this project that include 40 additional stories. And we're also using this as a tool to educate policymakers, department heads, others to understand the complex circumstances of violence and what community members feel are important and what they need. For firearm safety, our umbrella plan for this work is the LA County Platform to Address Gun Violence. This platform has a total of 40 strategies that we developed with county and community partners in 2022. There are 4 immediate priorities which we've been focused on. One is advocating for robust gun safety legislation, both here in LA County, in California, and nationally, including reinstating a federal ban on assault weapons and large capacity magazines, increasing violence prevention, intervention, and healing programs in general, especially those led by our grassroots organizations, to make sure we're investing in that local work. Improving enforcement and education about domestic violence restraining orders and gun violence restraining orders as a civilian tool to support those who might be at risk of harming themselves or others, and increasing access to comprehensive, culturally relevant services for school-age children, and a comprehensive school safety initiative. For our gun safety work, we have educational materials, and we also have free gun locks that are available. This began with a partnership with the Department of Health Services with county hospitals to distribute these in their lobbies for free, no questions asked, with educational materials. We have since expanded to LA County libraries. There's 5 tool libraries across the county that provide a variety of different types of tools. We work with health systems, including LA Care. Kaiser is a new partner. There are others. And also the community-based organizations that we contract with through OVP. We're also available for events. We have a team that can come out and provide more in-depth presentations around gun safety. And there's also a form on our website where anyone can request up to 2 gun locks that we will mail to your house. So I mentioned the gun violence restraining orders. This is it's complex. It's something that is unique in California. There are not many states that have this law, but they are to support people who have access to guns who are in a crisis and are showing signs that they might hurt themselves or others. And these are obtainable by police, family members and partners, housemates, employers, co-workers, school officials. It's a civilian remedy. It would remove guns and or ammunition for anywhere from 21 days or up to 5 years. We do work closely with different systems, including the DA's office, courts, law enforcement, to see how we can promote this as a tool when it is appropriate. It's not appropriate in every situation. And we have 2 system navigators who are available, William and Daniel, to assist with this process and understanding it if you are interested in learning more about it. We had a short-term project, the Youth Suicide Prevention Pilot, that just wrapped up in June. Fortunately, we received some funding from the probation department to continue a piece of this. And this initiative included rapidly reporting data on suicide deaths and attempts in LA County to better understand the circumstances and what we need to do to mobilize to address it. Crisis response strategies provide support for impacted families, and this included support group for youth in hospital settings and some other strategies, and increasing awareness of warning signs and reducing stigma around suicide in communities. So we helped promote a campaign called Never a Bother, which was a state campaign, I believe, and some other tools across the county. We also have new work in gender-based violence prevention, and these were as the result of board motion. So this just started this year. We were able to distribute $2 million in grants to community-based organizations across the county. That work is just starting up now and includes teen healthy relationship curriculum for high schools. We have 1 agency in each of the 5 supervisorial districts, and additional community programs focused on LGBTQ+ youth, for men and boys, and economic empowerment for young women. We're also doing policy and system change around this with other county departments to look at how we can work together to prevent all forms of gender-based violence, support trauma-informed and culturally responsive services, and education and awareness. And Clara Chang at our office is the lead, and her contact information is right there. We also have a new sexual assault council that was just convened early this year and includes, I believe it's 16 members that represent community organizations and county systems. And they are coming together to develop policies and practices to provide training and education around sexual assault, improve data collection and sharing, advocate for local, state, and national policy and funding, and to support system coordination. How can we as a county system better support survivors of sexual violence and prevent it in the first place? Nicole Paris is the executive director of the Sexual Assault Council, and her information is there. So I'm going to wrap up with a special project that came to an end, just a couple months ago. And then, it's a nice segue into the work Arthi is going to share around our trauma prevention initiative. But our office was very fortunate to get $25 million in American Rescue Plan Act funding, which is part of the federal COVID recovery dollars, to support the work that we do and OVP and our community partners do. It really was informed by recommendations we have been getting from our community partners through TPI, and allowed us to invest in more things that we had in our strategic plan that we didn't have funding for, and build on specifically our trauma prevention initiative work, including street outreach and hospital violence intervention, establishing a pilot peer-to-peer learning academy, which I'll talk a little bit more about, investing in youth healing, mentorship, and leadership programs, crisis response and community healing, school safety transformation grants and trauma-informed care programs. So we were able to invest in, I think it was 40 different community-based organizations for a total of over 50 contracts. And that was really exciting work, hoping to be able to continue if we can find additional funding. So just to spotlight something, and this is something we're planning to continue and maybe an opportunity for some of you. The Peer-to-Peer Learning Academy was focused on building training infrastructure for community-based organizations, specifically those who are in the field of community violence intervention or peacemakers who are out there in community. But we really strove to make it more holistic to meet the changing needs of the field, including working with different populations, working with youth, including a trauma-informed lens, connections to gender-based violence, other skill building. So this was open to the American Rescue Plan grantees. We worked with California Community Foundation. That was our fiscal administrator for the grantees. And we contracted with the Collective for Community-Based Public Safety, who implemented the academy. And we also invited our trauma prevention agencies to attend. This work ended in December, and we're hoping to be able to continue it with some new funding. Okay, we covered that. So that is my piece of the presentation. I definitely wanted to pause for any questions anyone had, and pose some questions to you, whether you want to raise your hand and share or put it in the chat. You know, we're really interested in knowing what forms of violence you're addressing in your CFCI funded work, and what topics you might be interested in a follow-up presentation or more resources or information.
And if you all want to drop your questions in the chat or raise your hand, and I can unmute you all, whichever you all prefer. Pharaoh Mitchell, I believe you should be able to unmute now.
Thank you. I appreciate that. And I appreciate all the hard work you guys are doing. We were part of the trauma prevention grants, and we helped a lot of people, a lot of women that was facing domestic violence, and we helped them relocate. My question is, are you guys going to continue that program to where the trauma prevention, or is it over with? Because there are a lot of women in our community, especially here in the Antelope Valley, I'm with the Community Action League, that need that help and need that service. And it was kind of heartbreaking to see it go.
Yeah, thank you so much, Pharaoh, and thank you for your work in the AV. You know, that funding unfortunately has ended, but the work was so important. I know we're trying to identify funding to continue some of that work and invest in more CBOs, particularly the Antelope Valley. That's definitely one of our priority areas for TPI. So we have submitted a couple funding proposals, and we hope to hear early next year if some of that funding will come through. It's not going to be at the level of $25 million like we had through American Rescue Plan, unfortunately, but you know, we are hoping to extend that, and I would love to connect you to our gender-based violence team, Pharaoh. If you want to drop your info in the chat, or I can put my email in if you want to reach out, I can connect you.
That would be incredible. And we had a class for survivors of domestic violence called the Women Empowerment class. And it changed so many women's lives, and we're helping them start businesses, and we're now working with their children and foster children on domestic violence services and digital art. So yes, anything that can help, we would be much appreciated. Thank you.
Oh, that would be amazing. Please email me. Thank you.
Thank you, Pharaoh. And then Deetra, you should be able to unmute now.
Hi, you were asking about what type of violence you were experiencing in the community. We're a human trafficking drop-in center. We're located on the Blade in Compton. Friday, one of our young women, so we work with the human trafficking victims, and one of our victims was ran over by another one in her car. So that was Friday. We get a lot of girls that come in that were beat by either their pimps or their or their clients or their traffickers. Let me get politically correct. And so, I mean, but that's the main violence that we're getting. But that was the most shocking one, was when a girl ran over another girl Friday.
Oh, that's so awful, Deatra, and I'm sure that like impacts you and your staff too, how to heal from, you know, all of the things that you're exposed to and the important work you're doing. I know you mentioned you're in Compton. Arthi is our lead for Compton, so I'd love for you both to connect.
Oh, that'd be awesome.
Thank you, Deetra. And then I think Carmelita, you should be able to unmute now.
Okay, wonderful. Thank you. I'm Carmelita with the Boyle Heights Arts Conservatory. We receive TPP funding for youth that are inside our LA County camps and halls. We created a workforce development program where while they're inside, they each earn $20 an hour, learning sound and lighting for live production. And then when they came home, their job continued for another 200 hours. We welcomed over 65 youth during that year of funding, and we were able to secure additional funding to run the program for another 3 years from other sources. The one area where would be most helpful in supporting violence prevention is really working hand in hand with housing. Because when these young men and women come home back into the same environment, it's unreasonable to think we're going to get a different result from the same situation. So youth housing is one thing that we have been able to cover in a very like handful of young people. And we have seen firsthand how important it is when they do come home, if they have a different place to go to. So as we continue conversations, I would love for the county to be able to explore not just workforce development, but how can we house these young people? Thank you for your time.
Thank you, Carmelita. I remember your project. It was quite an amazing project. I think we'll have the final evaluation of TPP that we can share with everybody pretty soon. But you're absolutely right. Housing is such a critical need, and you know, how to help folks return, as you said, so they're in a safe environment and they can thrive. It's definitely a need for us to connect. Thank you.
Thank you. And I think we have a couple more questions. Deetra, I think you already spoke. And then Danielle, you should be able to unmute now.
Hello?
Yeah,
Can
go
you
ahead,
guys hear me?
Danielle. We can hear you. Yeah.
Hi. First I want to just say thank you for the work that you guys are doing to advance healing in our communities. So I'm with Unite a Nation, and we have a program called the Power Program, which is policy, outreach, wellness, education, and reform. And our focus is on healing movement in our communities and how our natural resources heal our bodies and our mental health. And so we wanted to know if there's an avenue that you guys are taking to provide funding, but also to help bring this into the community. We're in South Los Angeles, and we more are a mobile service to provide these services to our community. And how do you guys, because I just noticed like a lot of the departments focus on health and just in one way, but our goal is to like bring health in a whole different way to our community that's natural, that's free, that's cheap, and that everybody deserves. And do you guys have funding opportunities for that, or do you guys have a lane that you guys are bringing organizations into?
But I think I can say, Danielle, we might have funding for that, but we'd love to hear more about your organization. If you can email Arthi and I. We're in 4 communities of South LA. We might have some new funding coming up soon. we've also got an opportunity to connect you with our Community Action for Peace networks as
Okay.
well. There might be some other opportunities there. But yeah, we'd love to hear more.
Awesome. Thank you. What's your emails, or are you guys going to share that?
They're in the chat.
Oh,
Um,
I do.
Yeah, and I think we can definitely send out the slides as well to Joanne and team. So, you know, they can share our contact information so you don't have to scroll through the chat to find it as well.
Thank you. I appreciate that. Thank you.
Yeah, we'll definitely get the slides and everyone's contact information out to everyone. Rosalind, you should be able to unmute now. Rosalind from P2P, are you able to unmute?
Oh, I'm sorry. Okay, I was
No
just
worries.
talking away. But yes, I'm Rosalind Rashid, and I work directly with Pastor E with P2P, that's Provoke to Purpose Community Development. And we did receive funding for the CFCI satellite sites for gang impacted communities. So we work direct in the communities providing conflict resolution programs. And our focus is on actually providing a pathway out of poverty, because we know that a lot of our people are out there committing assaults on each other because they're depressed and they need some resources and they just need some help. So Pastor E does a program where we mentor the youth. We also train and develop them. We have a printing shop and a training program that we take our youth through. And our goal is to help them with the resources like jobs and business skills, help them to get developed so that, you know, they have more opportunities. And, you know, our focus is on mentorship. So we like to bring them together. We just recently have taken about 160 youth and family members out to the Dodgers game. We took them out to the Angels game about a month ago, but the Dodgers game just a few weeks ago. And that's an opportunity to get people that don't really know each other, get them in an environment where they can, you know, meet each other and greet each other in a safe environment and get to know each other. So we would just like to see more funding, you know, given out so that we can continue to do the work that we do. Right now, the program supports the ages 14 to 24, but we found that we have a lot of younger youth, as young as like 8, 9 years old. We like to work with them as a diversion, you know, with diversion programs. And then the older ones, you know, we have youth, we call them youth, but some of them are almost 30 and 31 and 32 years old, and they're still in need of a lot of help as well. So we just want to see these programs continue, and we thank you for all the work that you guys do to help in this effort. And that's all I have to say. Thank you very much.
Thank you. And I think that was our last question. There were some answers to your question, Kelly, in the chat. I hope you had some time to review those. If not, I'll share the chat with you all as well. But we can move on. Thank you.
Yeah, wordy, yeah.
Oh, that would be great. Thank you. And thank you so much, Rosalind.
Oh,
Arthi, I'll pull the slides back up for you. There's going to be more time for Q&A later if folks have other things they want to say or ask about. Oh, did it work? Okay, there it is. All right, Arthi, it's all yours.
All right. Thanks, Kelly. Good afternoon, everyone. Just a quick shout out, Deatra and Danielle. I wrote you both in the chat when you were sharing your comments with both my email and some information to connect related to Compton for Deatra and related to County Parks and Rec around, Danielle, your focus area for your agency. So just wanted to flag that for you because I know the chat can get hard to keep up with, but I did flag you both to connect with me directly. So I'm Arthi Harper. I get to work with Kelly, which is pretty awesome, and our amazing team over at Office of Violence Prevention. Your Office of Violence Prevention, we like to constantly remind folks of that we're county office. Anyone who's in LA County, we're here to be a support to agencies and residents in our county. Next slide. So as Kelly has mentioned a few times, the Trauma Prevention Initiative, or TPI as I'll be calling it, is our really kind of our main initiative in the office. It actually predates the office. It's older than the office and was a lot of the reason that the Board of Supervisors and there was a county push to really create this office, to really expand and coordinate a lot of the work that's happening across our large county around violence prevention and intervention. TPI is our public safety strategy. It's community-based, it's comprehensive, and it's place-based. And as Kelly mentioned early on, it started out really centered in our unincorporated communities, really wanting to center those communities that we know often don't get enough resources and representation and are the responsibility of the county. Next slide. So TPI has several funded strategies, and when we think about violence and violence prevention and think about public health specifically, because our office is in the public health department for the county, people often think about public health as prevention, and we are prevention oriented. We definitely want to prevent people going through trauma, violence, negative health outcomes, harm. But when we think about the issue of violence in a public health approach, we have to think about intervention first. I think some of you have probably heard this example of when someone's house is on fire is not the time to talk to them about fire insurance. It's the time to get a hydrant or get out of the way. And so for us, it's the same approach for violence prevention as we're looking at the communities that we decided to focus on initially in South LA for TPI. We knew we had to invest downstream, frontline, and intervention. And we do that two ways, through the hospital violence intervention program and through our street outreach and community violence intervention. And then, quelling that initial violence in communities, we want to build up capacity of the agencies and the individuals doing that work, that peacekeeping and de-escalation work. So we fund capacity building two ways, both through a training and technical assistance strategy that builds up the organizations doing this work, and also a peer-to-peer violence prevention learning academy, our P2P. It sounds like there's a couple P2Ps in the room, but the one that Kelly mentioned around building that workforce of folks who do that community violence intervention work, peace building work. So we have a larger workforce in our county to build that pipeline for long-term response. And then prevention-wise, really once those things start to happen, we can talk about prevention and community-based prevention efforts that will take root so that we can have lasting community safety and well-being. Next slide. So as I mentioned, when we started TPI, we looked at the data, and as Kelly mentioned in an earlier slide, public health is really focused on looking at using the data to decide where the need is. We know that equity really means going where the need is the greatest and making sure that the resources are based on that approach. Where is the need most and where do we put in those resources? And so based on that, we knew we had to be in South LA based on the data, and drilling down more specifically in South LA, the 4 unincorporated communities we started in were Westmont, West Athens, Willowbrook, Florence Firestone, and unincorporated Compton. In 2022, based on that initial success in South LA TPI, we expanded to other communities outside of the 2nd District, in the 5th District in Antelope Valley, in the 4th District in Norwalk and Hawaiian Gardens, and in the 1st District in Pomona, Puente Valley, and East LA. Next slide. So now I'm going to break down a little bit more about each of those strategies that we fund. First, as we talk about intervention, what is hospital violence intervention? So I know we have, just looking at the chat, I know we have a mix of new and existing partners in our work and folks in the space who do this work and are very, very skilled at this work. So when we talk about HVIP, as we call it, it's really about a community-based organization that has that credibility in community because they're bringing in folks who or maybe previously were, are from the community or previously in gangs or have that ability to navigate those dynamics and have credibility, license to operate, as we call it, and bring them in to be part of their organization to partner with trauma centers. So when victims of violence come in, they are able to be bedside once that patient is stabilized and work to connect them with resources. So sometimes the way HVIP can look is the CVO is embedded in the hospital setting, or it might be a referral out to that CVO to connect that individual with services once they're stabilized. So it's a 24-hour response. What you'll see in some hospitals is where they are just part of that trauma team. And once that individual is stabilized, that HVIP organization staff goes in. And unlike sometimes some of the hospital staff, the case manager, social worker, their case manager, their team is able to build trust with that patient and really connect them to the necessary services to hopefully prevent any future violence or them returning to the trauma center because of that license to operate and that trust they have. So here you can see some of the services they may connect them to: victims benefits, counseling, employment, housing, substance use. And sometimes the patient themselves may be hesitant, but these services can also be extended to their loved ones who may want to connect with services as well. And sometimes that's what leads to the patient ending up getting into services. So we started at one hospital in South LA initially, and now we're in 4 hospitals across the county in our TPI communities. Next slide. So the second prong of our intervention funding is around street outreach and community violence intervention. So also known as community violence intervention, CVI, an evidence-based field that under the previous administration, the Biden administration, was funded largely. And so you may have heard that term. So that is really about supporting organizations who are certified and have the credibility to do that escalation work, what maybe was called what was called gang violence intervention in the past, more now street outreach, community violence intervention. So those services can include safe passage, peace mediation and de-escalation, case management and linkages. And so they really are able to connect community, prevent retaliation, work on the other side of the yellow tape in terms of responding to community needs after an incident or a crisis occurs. And they also can be part of peace activation events that really build that long-lasting community peace. Next slide. So from this intervention funding, we've been able to create some strong protocols with some of our different county departments and community partners. So with the Sheriff's Department, we've created an incident notification protocol with our office so that they are able to notify through us agencies about incidents that may occur. We want to make sure there is that professional understanding between law enforcement and community violence interventionists so that they need information when an incident occurs so that our CVI specialists can be out in the field to prevent retaliation, do rumor control, all of those key strategies to prevent future violence. We have a gang intervention incident notification protocol. We have safe passage protocol with Parks and Rec. So we are LA County, so that's LA County Parks and Rec is who we work with. We know the city of LA also has a Rec and Park, Recreation and Parks Department that is a different department than our county one. They do communicate, and we do try to communicate cross with city and county. Some of you might know GRID, the city's Gang Reduction Youth Development Initiative. They work closely with the city's Rec and Park. And in somewhat of a similar way, we work closely with LA County Parks and Rec around. So our intervention teams do work with them, providing safe passage and doing community engagement events and around their parks programming. We hold a regional intervention council, which is a monthly meeting with our team, our leads who work in TPI, our related street outreach agencies and the park staff and the related sheriff's department. So we work with, whereas the city works with LAPD, we work with the sheriff's department stations to talk about what any incidents that are happening month to month and where to support. We do peer learning. So I'll talk a little bit more about how we do support for our agencies that are doing this hard frontline work and opportunities to build their development and training opportunities, as well as self-care. So in these contracts for our intervention agencies, we have a self-care line item. That's something that we're really trying to advance, is something we hope will be systems change across all contracts that fund peacekeepers and community violence intervention workers, that there is a dedicated line item for them to take care of the healers and the helpers and not reroute that money to programming or other things, because we know all of you all are frontline workers too, and you all are about giving the work and the help to community, but you all need support as well. And we want to make sure that we support all the frontline folks doing the work so they can feel restored and get rest as well. And also our intervention workers play a lead role in our community action for peace coalitions that we'll talk more about in a minute on the prevention end. And then as part of the hospital violence intervention work, our office convenes a consortium of folks across the different hospitals we work with, and also with some cities in the county that are looking to create their own HVIPs to move forward in coordination on this strategy. Next slide. So as I mentioned a little bit about self-care, Kelly mentioned our amazing one-woman show of our trauma-informed care specialists. It's a huge job for one person, But one of the many things she does is provide our office with resources, this great trauma-informed care toolbox that can be shared, that is on our website for the public. But in addition to that, she really reminds us of the need to, be trauma-informed and healing-centered in our work with our community partners. And we have a community violence intervention specialist, Lanesha Edwards, who really guides the work for TPI around working with our agencies and healing center protocols. So she holds quarterly convenings with our agency staff that do the frontline work, self-care retreats. For a while, we had a contract with Westmont Counseling Center to provide free mental health support to our community violence intervention workers. And we recently received funding through the federal government, DOJ, for Community Violence Intervention Prevention Initiative that's centered on healing. So this is non-traditional healing opportunities for for our intervention workers and for youth and youth leadership opportunities to support them. Next slide. So these are just some pictures. We've had 3 self-care retreats at this point. And so what you can see here are some pictures from those 3 retreats. And these annual retreats started back in 2023, and they're to provide frontline CVI practitioners some dedicated time to pause. It's for fellowship, for connection, for rest, for healing. We try to hold these in outdoor spaces very intentionally. I think Danielle was the one who spoke a little bit about the connection and the value of, nature and outdoor space. And so we see that as well and want to bring them away from the frontline work they're doing and into some open spaces where there's that energy and that flow of nature in the outdoor space for them to have both individual and group outlets to really feel restored. And so what you see here are some of the different activities. There's art space projects. Last year we took them to Dockweiler, and so some of them are surfing. Our latest one was last week, and we went over, if you haven't been to Friendship Park, it's a county park in San Pedro, please go. Beautiful views, great spots to sit and either be alone, which I love that picture on the right, just taking that time to be alone or with a group. So really just trying to provide opportunities to support this team of folks who do such important work. Next slide. So I'm going to talk a little bit here, provide a little detail here about what some of our protocols look like. So as I mentioned, we have a CVI specialist in our office who developed these protocols, collaborates with the city's GRID office as well, because we know some of our agencies are funded by both us and GRID. Also, sometimes incidents happen across city and county lines. So there's a lot of collaboration that happens to make sure there's some alignment in the protocols, and we're relating to the respective county and city partners. So as you can see here, here's an example of some of our protocols around incidents that occur and just kind of showing what our teams do in terms of what that response looks like, both to our TPI team and to the team on the ground that we fund to respond to those incidents. Next slide. So as you can see here again, here's just some of the guidance that we provide around notification, around license to operate, around a critical piece that's part of just the CVI certification around not crossing that yellow tape and understanding the professional understanding that exists in the field of CVI, and then really gathering that relevant information to address rumors, manage peace, and really kind of connect community with needed services. Next slide. So here's a specific protocol example of if there's a shooting or death, what our teams often do in terms of responding. So again, this is just giving you kind of a glimpse into what the agencies we fund that are doing our intervention work do, what it can look like in the case of various scenarios. Next slide. So as I mentioned earlier, the parks are a key partner. LA County Parks and Recreation is our key partner, I would say, in this work, because we really see how for a lot of folks living in high density housing and communities, parks are really their backyard or their second backyard. It's a communal space. We want folks to feel safe and feel like that's a place for community and connection. And Parks and Rec feels the same and really wanted to partner with us in TPI and so that they really can be those community hubs. So our street outreach agencies partner with Parks and Rec in the county to provide safe passage and peacekeeping at their parks after dark programming as well as their RSPART programming, which is their teen programming that runs year round. And by doing that, our agencies are not only working to address and intervene in violence that may occur at the park or tensions that may occur, but also building those relationships with youth and family to prevent incidents and for families to feel like there's someone trusted in community they can call, especially if they have any distrust or concerns or discomfort around engaging with law enforcement, that they have these folks that are trusted in community they can turn to for safety and support. Next slide. So Parks are Safe Zones is a campaign that was created by our interventionists in Westmont, West Athens, our first TPI community. So that Safe Zones language came from them, very intentionally speaking to language that's often used when we talk about prison and safe zones being, the chapel and the visiting area, and they're off limits. And they wanted to bring that language out to the parks to reclaim the parks and say to folks, we want kids to play here, we want families to feel safe here, the parks are off limits to violence. So this campaign really started initially in Westmont, West Athens, and working with Parks and Rec in the county. Because the county is so big, they have regional offices. So the South LA, the South Agency of Parks and Rec, decided to partner with us and make these metal signs in all of their South LA parks. And so South LA County parks. And so if you go out to any of those parks, you'll see these signs up, and it's really been a way. They've also been added to bus shelters or billboards, and there's even the lawn signs that people, often residents around who live near the park, will have those signs on their front lawns as well. And it's really an example of the power of our intervention workers and the trust, the value of trust, right? That so much can be achieved if you bring in the right messengers, the credible messengers, to really work for safety. Next slide. So specific to the park, similar how I showed you some protocols, these are protocols that our CVA specialist is developing with Parks and Rec around incidents that happened within the park setting or near the park setting, and just kind of shows how our teams coordinate with park staff, either in response to or in prevention of these incidents, especially when we think about parks programming and what park staff may need to know to keep young people or families safe that are coming to programming after an incident may have occurred in or near a park. Next slide. And then here's another example. We know that beyond some of the violent incidents on the previous slide, there can just be some activity at the park that can make families feel less comfortable bringing their kids. And so sometimes these are protocols that are in place that our intervention workers can use to help just kind of work in partnership with the park staff so that everyone feels welcome at the parks. Next slide. So as I mentioned earlier on when we broke out the different funded strategies of TPI, I just covered a lot of the intervention work, what that looks like when we talk about TPI's funding intervention. So as we talk about capacity building, I mentioned there's two lanes of that. One is around how we support agencies, and then the other is how we support the various individuals frontline that are responding in our communities. And so around the agency side, we've now had several years of being funded by the probation department to select agencies in our inner near TPI communities to really provide them with a lot of that technical assistance training to make their organizations that much more effective and sustainable in the work that they're doing. We know that a lot of the folks that are doing that frontline work have that programmatic expertise, but it's also a business. And sometimes running the business part of it can be very daunting if you didn't have some of the trainings that other business folks go to. And we want to be able to provide them with opportunities that allow them to feel stronger in that area. I like to think of it as organizational self-care, so that they're building up the health of their organization to keep doing the great work that they're doing, because they have great staff. Their staff know what to do. It's not about teaching them how to do their lane of the work. They know better than us, but it's about how to support their organization to stay in business, to keep doing the work. Next slide. On the prevention end, as I talked about, if we're funding violence intervention, both in the streets and in the community and in the hospital, for funding organizations to help build their ability to keep doing the good work, we also want to then build in opportunities to get community-driven public safety solutions. Learn from communities, especially in these unincorporated communities where they haven't always had a seat at the table or had a table to convene to create that space. So that's what these Community Action for Peace coalitions are. Working with our residents, agencies, other stakeholders, faith leaders in those communities to build a CAP table or to expand an existing coalition that exists in that community to bring in trauma, violence, community safety as a priority and get resident-led solutions. And so we started in 2014 with that first CAP in Westmont West Athens, and then added Willowbrook in 2018. And now we have CAPs or developing CAPs in all of the communities, and they really are a space that everyone's welcome to. Later, when we talk about collaboration, this is definitely a place where your agencies are welcome, always at the table, both to share out information about what you're doing and also gather information from others at the table about ways to collaborate. So I'll share more information at the end about how to get connected with each of these. So the ones in your community you can connect with. Next slide. So here you can see, we just want to show you currently who we contract with. So as I mentioned, for our intervention work and our prevention work, we fund agencies who are implementing these strategies. And so specific to the street outreach and community violence intervention and hospital violence intervention, those are agencies that have expertise and certification, staff that are certified in community violence intervention, know how to do hospital violence intervention. And then on the community engagement side, these are agencies that have experience with meeting facilitation, community coalition building, community engagement. And so these are our current contractors, and we put this up because you may also be working with them or may contract with them or partner with them in some way. So just want to be transparent with you about who we're working with in case there are opportunities to collaborate. Next slide. So here I want to break down a little bit more. As I mentioned, we have the CAPs in each community. And I'll update some of this information because we had some internal staff changes and promotions. So some of the community health workers have updated, but the leads are all correct. So as we share this information, feel free to take a screenshot, but also these slides will be shared. So you'll have all this information and you can attend any of these CAPs. So this is first district, then we'll go into second district. Oh, yeah, so we'll update some of this too. I see that some of the people have changed. So next slide. All right, that's me. So those are my CAPs. If you ever want to come through, you're more than welcome. Next slide. All right, and like I said, you'll get all this in an email form, so then you'll have all that contact information. Next slide. So I'm going to pause here, similar to how Kelly did. We want to take a breath and take a moment to hear from you. You know, now as you've heard more about TPI, I definitely want to hear from you. If any of you are working, I know some of you, because I know who you are and I saw you in the chat. So we know some of you are definitely working with us as TPI contractors in community. So feel free to share as well, because you bring a lot of expertise to the space, just doing the work day to day. But also if there are any of you that are working in or near our TPI communities, we'd love to hear, as well as knowing that in addition to maybe connecting with our contractors or our CAPs, are there other ways you want to partner in our shared communities? So I'll just open it up to whoever wants to share.
And same thing as
however you-
before, feel free to raise your hand and then I'll unmute you, or you can drop your question in the chat or the Q&A. Pharaoh, I'm going to ask you to unmute.
Yes, this is Farrell from Nantelope Valley, the Community Action League. And we know these organizations that you work with. We would love, love, love to partner with you guys because we do a lot of this work in the community, and we would love to partner with you guys to do the work. So please reach out to me in the email. I put my email in the chat so that we can help continue this work.
Awesome. Thanks, Farrah. Remind me, you're in the Antelope Valley, is that correct?
Yes, I am.
Okay. Can you do me a favor and put your email in the chat one more time? Because now it'll be at the bottom and then I can copy it down on my pad here.
Yes, and most definitely the Helper Foundation, we
Yes.
work closely with them too.
Oh, perfect. Because that was going to be my direct line for you. My first stop was going to be Stan and his team, who are out there doing great work. But yes. So
Ansar is one of my best friends.
see, then I don't know if you even need me to connect you. Sounds like you got all the connections, but definitely happy to reconnect and you with their team and kind of reinforce collaboration opportunities for sure.
Okay, thank you.
Yeah, thank
both.
you.
Quickly, I'm going to go to a question we got in the Q&A from Sandy from Olive Support Services. It says, I noticed that the Antelope Valley caps are TBD. How would we stay informed regarding upcoming caps?
So that's a good question. So yeah, so they are kind of developing slowly. So what I will do, like I said, the TPI lead for Antelope Valley, Nellie, would be the person to contact, or the community health worker, Marcasia. That way, once it's up and running, or even if it's in this formative stage, they can tell you if there are some meetings happening already to be part of. So we'll get those when the slides go out to you. You'll have that information, and you're welcome to contact them directly and ask like, hey, what's the status of the AV cap? We'd love to learn more or attend if they're in place.
Thank you.
And what
then-
organization are you
go ahead.
with, you said?
It was in the chat. It was in the chat, but she's with Olive Support Services.
Oh, thank you so much. Okay.
Liz Smith, I'm going to unmute you or ask you to unmute.
Thank you so much. Can you hear me okay?
Yeah, we
Yes.
can hear you.
Perfect. I just wanted to say thank you all for having this today. It was very powerful to hear everyone, and just this whole is so important. I'm from Living Advantage Inc. We're a 30-year nonprofit in Los Angeles County. I noticed that the areas are a little out, but I just wanted to put out there that we would love to partner if there's anything that's going on, or any CBOs that are interested in connecting. What we do is we actually have a youth center that is in Los Angeles that's focused on foster youth, and we do gaming, we do life skills, emotional intelligence for any youth between the ages from 12 and young adults to 24, 26. So I'm just putting, our information out there, just saying that we would love to partner, collaborate with you all, any other CBOs that would be interested in us. We're close to Leimert Park. We're Art of Practices. There's an art gallery right there. And I just wanted to put our information out there for you all. So if there's any partnerships available, we're very interested.
Thank you so much. I think another resource or connection opportunity we bring is that we're county. And so not everything that everyone may request is something our office can provide or fund. But one thing we see ourselves in a role to do and want you to seek us out to do is make those warm contacts. Even,
Yes.
many of us are county residents, work in county government, and still find it hard to sometimes call a different county agency and get someone on the phone or make those connections. So if we can be of service there, and I think about with what you just shared, like we have a Department of Arts and Culture in the county, which is doing amazing work and funds agencies around, they're doing youth development work, art and healing work, and things like that. So there could be opportunities for us to connect you with them. Department of Economic Opportunity, the libraries, as Kelly mentioned, are a huge partner around public safety and arts and culture. And so those are opportunities too, where sometimes you're asked to us maybe just to connect you, where we connect you with may not be someone in-house, but more another county department we partner with that may be an opportunity for funding or collaboration in some other way. So I just say that to say, use us in all those ways. In the end of this packet is also, in this presentation is also Kelly and my contact info. So you're welcome to contact anyone whose contact info is in this slide deck. We want to be accessible to you.
Awesome. Thank you so much. I put my information in the chat too, as well, with our email and our website and number. So
Okay.
Thank you. Thank you so much.
Yeah, thank you all.
Kelly and Aarti, I can make sure that the chat gets shared with you all. I know there's a lot of emails to keep up
You
with.
read my
so don't
mind. I
worry.
was just gonna ask you
no
that,
worries about
Ariel.
it. No worries. I'll
Thank
make
you.
sure I
That'd
get
be
that over
great.
to you all, and then vice versa. I'll send out the slides to everyone in attendance today, and then our the recording will also be available on our website. I
Sounds
don't
good.
think we have any more questions. I don't see any in the Q&A or in the chat, but if I missed any, feel free to raise your hand and I can unmute you. I think that might be everyone's questions. Well, thank you all so much.
All right. Are you able to put the slides back up, Kelly? All right. So the next section is about how we collaborate with cities, what our city-county collaboration looks like. As you know, we are a massive county. We would be, I think it's the 7th or 8th largest state by population if we were a state. So we're huge. And so I think there's plus in that. Diversity is our strength. We have so many different organizations working across the diversity of our populations to support them. But we also, that means it's a lot of work around coordination and collaboration. How do we support agencies doing good work? How do we elevate and look to replicate some of that good work and partner across? So next slide, we'll talk a little bit about what that looks like. So within the county, as part of our TPI initiative, we have an advisory committee that was started. And that advisory committee is made up of representatives initially from our different county departments. Really an intentional way that we wanted to bring in our county departments to see themselves as public safety partners. That when you hear public safety, it's not about one organization, namely law enforcement, that is responsible for safety. It's a public safety is a system, and whether it's a city or a county, it's lots of those departments and the community, faith leaders, jurisdictional partners playing a part in how we keep our community safe and healthy. And so we bring them in not only to get feedback on how TPI is being implemented, but also to make those connections. As people have brought up, there's opportunities to connect Parks and Rec, arts and culture, economic development with the work that we're doing, how to bring those resources that they are responsible for providing into our TPI communities, unincorporated areas that have not been prioritized, but maybe by giving those zip codes to our county department partners, they can bring more workforce resources, food and security resources, other health resources to these communities in a more targeted way that is equity based and that also brings in much needed resources. So we create those direct linkages over time as TPI has grown. We have our contractors attend those meetings. So there's a direct line, exactly what we were talking about. How can we make it easier for our community partners that we fund doing the frontline work to be connected with county departments, whether it's around arts-based healing, housing resources, mental health, workforce development, substance use. We just want to make those connections more direct so they don't have to go through us and they can get those direct lines to help. And then foster that collaboration so that we really do push for systems change. How can we make a, safer LA County for all? Next slide. So I named the GRID, City's Gang Reduction Youth Development Initiative. We have some intentional collaboration with them. They are a key partner for us because we really feel like there has to be city and county alignment. People in LA County live across city and county lines. So agencies that are doing the work of violence prevention intervention, some of them are contracted with both GRID and TPI and, responding to incidents across that impact city and county. And so we want to make sure that there is a alignment and regional coordination. So we have an existing MOU with the City of LA around our work together. We have ongoing meetings with our team and the GRID team around how to, align protocols, resources, events. Sometimes when there are incidents, can also be what are the opportunities you're doing for summer? How can we partner with you to make sure communities feel supported? Technical and training assistance. So where there are opportunities where we're doing trainings for our contractors or they are, how can we cross train to bring more resources to both city and county side? And then collectively, how can we both be advocating for more funding and more support for the field of CVI, both at the local level and at the national and state level where possible. Next slide. So as you can see here, this map shows you where our TPI communities are in relation to the GRID communities. So GRID is in blue, TPI is in green. So one of the things I didn't mention when we were identifying initially based on the data, where to focus in South LA, because the data said South LA is where we should look to start a place-based community safety strategy. we didn't just look at what you would expect in terms of what's not working or what's, harming these communities, but we looked at some of the data around the assets that they had. So some of the assets we looked for were, do they border a grid zone? Do they have a county park that is already or could be later activated for parks after dark? And are they within 5 miles of a trauma center because of that HVIP strategy? So picking these communities very intentionally that are by grid zones was because we know that if grid has been around for a while and it's been successful, and so the more success it has, that means those communities are seeing violence trends go down. But where might that violence then go? We knew that we had to be in the communities that bordered those grid zones. So there's a city county approach. So the residents in those unincorporated areas feel like someone is advocating for them. There's investment happening here so that there is a coordinated effort to keep communities safe. So that's really what this map shows of how we work together. Next slide. So some of our additional partnerships, there's 2 other cities in the county that are that have their own health department. So while we're the county public health department, the cities of Long Beach and Pasadena have their own public health departments or health and human services departments. So which means they have their violence prevention work runs through there. But that said, they, especially Long Beach being the 2nd largest city in the county, we want to make sure we are working closely with all of them where we can align resources and share best practices so that, people again feel like the county is talking to the various cities doing work. So currently we collaborate around CVI, we coordinate around coordination and best practices, and new opportunities they're coming up are opportunities for school safety, gun violence, and youth development. And City of Pasadena also is a recent new partner in that. Next slide. Oh, sorry, I said City of Pomona, my bad. Next slide. So when we think about TPI's added value, we feel like we're adding to this regional ecosystem. So there's this language around the ecosystem that comes up a lot and talking about CVI specifically. And what we know is that each community, to do this work well, there has to be kind of this micro community, this ecosystem where the community violence intervention work can take root. And you have a pipeline of credible messengers, folks certified in the field to do this work, and you can layer on that capacity building and prevention work on top of it. So we feel like TPI has added value in a few ways. There's now a regional approach. We see our role again in really working across cities and unincorporated communities that often get left behind, and really being able to pull in some of those quote unquote public safety agencies and have agencies that don't see themselves centered in public safety really start to be involved in that and see themselves have a seat at the table. We want to connect. We've been connecting and aligning our strategies in some of the hardest hit communities. So as Kelly mentioned earlier, the communities that are heavily impacted by violence in the county are also the communities that were heavily impacted by COVID and that remain heavily impacted by a number of issues. So thinking of that tree again, it's really about getting into the roots and addressing those root causes so these communities hardest hit can be healthy long term. We support systems that address vicarious trauma. So again, not just for the community, but for those helpers, frontline workers like many of you that are responding to community trauma. Capacity building for those grassroots organizations. And we're really working to make our contracting in the county more equitable. We don't have that much authority. We're still, like Kelly mentioned, we don't have full authority in the county to change everything, but we are advocating and bringing community feedback to our department in terms of ways to make our county contracting work better for community agencies. Training around those cultural shifts of how do we make our county systems more survivor and healing centers so folks really in need of support feel welcome to engage with our services. Career pathways, we want to create opportunities for folks doing CVI work and other frontline work to have career pathway and advancement opportunities. And then the CAPs really allow us to advance community-driven public safety strategies and solutions, especially lifting up these unincorporated communities that often don't have an advisory body or space to do so. Next slide. So lastly, we'll just share a couple ways, name a couple ways to partner with us or to get connected and stay in the loop with us. So a couple are we have a monthly newsletter. There's a link here. Again, you can scan if you have your phone nearby and it'll link you to everything, or you'll get the slide deck and then you can get signed up for things. But it's a once a month newsletter. I swear we don't spam you and send you a ton of stuff in your inbox. It's once a month. It's really helpful. It often just spotlights some of the work we're doing. It might also spotlight some of the current issues happening in the field of violence prevention, or highlighting things like Suicide Prevention Month or Domestic Violence Awareness Month, Gun Violence Awareness Month. So it's a good way to stay connected to what our office is doing. Our main website, which has a number of resources for the public that you can share with your community and partners you work with. Free gun locks, as Kelly mentioned, as part of our firearm safety campaign. We do have free gun locks that can be given out through our website. Any resident can order 2 free gun locks, but if you as an agency would like to request a bulk amount, like 50 to take out to a tabling event or take to an event you're doing or just have it out at one of your events, or we can do that. And you can just contact our colleague Mia to put in a request for that. And then as your county office, we do have a epidemiology team. And so they can fulfill data requests. So you may be writing a grant or looking for some data that's going to inform where your agency prioritizes your work or where you might be shifting. You can put in data requests to this email. And we have a number of data sources we can pull that from. We have a whole data team. Next slide. So then some opportunities specific to TPI with your agencies. Again, connecting with our street outreach agencies, you'll get the slide deck and it'll have the TPI lead. And so you can reach out to that lead who manages those contracts and they can connect you with that street outreach agency, or they can connect you with the community engagement contractor who facilitates the CAP meetings. So on the slide deck as well, you'll have the location and times for all the CAP meetings, and you're welcome to just pop in. There's no RSVP. You could just show up and have a seat at the table. And we welcome you, and you're welcome to share that with whoever may be interested. And then lastly, as Kelly mentioned earlier on, we finished our pilot phase of our peer-to-peer academy, and we're hoping to, we're hopeful for some new funding where we'll be able to do another phase of it. So that's in development right now. Next slide. So as I mentioned, here's our slide, our last slide. It has our contact information. Lanisha couldn't be here today, but she's our CVI specialist. So you're welcome to email her as well if you have questions specifically about our agencies or the protocols related to our community violence intervention work. I'll just pause there. I don't know, Ariel, if there were questions we were going to do again, or if any other closing.
Any additional
Thank you all
questions?
so much.
Oh, sorry, Arthie. There are no additional questions in the chat. No one has their hand up. I think we are good to wrap up. Thank you. And yeah, we'll get these slides to you all in the recording on our website.
Great. Thank you so much, Kelly and Arthi, for joining us today, and the amazing presentation and all the information that to share with our grantees. We look forward to you all making connections with them and see how we can help each other support the work. So thank you so much.
You all are getting lots of thank yous in the chat, so I know everyone is grateful for the information. So thank you.
Thank you all so much for all the great work you do and for making time.
Thank you, everyone. Have a good day.